Starting. All attendees are in listen-only mode.
Good afternoon, everyone. Welcome to today's webinar on why another coalition means even more consultations. The webinar will be hosted by Rion Jones, TCI Programme Director, and Elizabeth Gamble, TCI Director of Standards. You will have the opportunity to submit your questions during the session, and we will try to answer as many as possible. I will now hand you over to Rion and Elizabeth.
Good afternoon, everybody. Thank you very much for joining us, and I hope that you have the sunny afternoon that we do here in Biggleswade. I'm sad in a way that this is voice only, because if you could see us, Rian and I are surrounded by manifestos and paper, which we hope very much we are going to be able to distill the essence of for you today. Because 5 years ago, we were on the brink of the first ever peacetime coalition, and it's fascinating to look back at the Institute's analysis. Rian, as ever, produced a Tuesday topic. It was number 160, and can you indulge me with a little quote from it? Let's remember how impossible it is in these days to contemplate any meaningful change without serious engagement with those who are affected. The more the politicians and the media talk the language of change, the faster will civil servants sharpen their pencils to prepare for a torrent of consultations, if only to ensure that the change that happens is properly thought through and avoids too many unintended consequences. Those was rather prophetic words, I think, there from Rian. But we also found that we had an analysis of the coalition agreement where we tried to anticipate not only what consultations would be necessary, but what significant promises were being made that related to public engagement. And that's absolutely fascinating to relate to the situation that we find ourselves in today. So here we are thinking about the extent to which a new coalition might mean even more consultations. But there was a lot of talk on TV last night, the last time the leaders of the parties had their opportunity to have their say. So is there actually going to be a coalition, Rian?
Yes, well, good afternoon, Elizabeth, and good afternoon, everybody. Yes, indeed, will there be another coalition? When we first agreed to do the webinar today, I think they were all talking about the language of coalition, that, as you know, a lot of the main party leaders have been backpedaling like mad ever since. So my starting point is to say to you that in reality, the situation of the 5 years ago Lib Dem coalition is actually quite extraordinary. I wonder if some of you saw the television program. They did a reconstruction of the 5 days following the results last time round and how the Lib Dems and the Conservatives put together what is, by any standard, actually an amazing document. Elizabeth has it to hand right now. I don't know if you realise, but there were 407 different commitments made in the document they called the Coalition Agreement. Now, we went through them. We're just looking item by item and asking ourselves the question, does this mean there's going to be a consultation? Or does it mean something else? Have you got the statistics with you, Elizabeth?
Well, I mean, according to the paper that was published, we sort of say, amongst its 407 proposals, it commits to review something on 31 occasions. It will consider proposals 11 times. It will investigate 10 times. And it will explore 6 times. Add 4 more issues they will examine and 3 things they want to look at, and you get the picture.
And I suppose, not having been in the room when they did the coalition agreement, we don't know how many of those are couched in those terms because they weren't able to agree. It was a kind of compromise wording because maybe the Lib Dems wanted to do one thing and the Conservatives wanted to do something else. Or was it a question that we need to do a review, we need to do a consultation because we actually, neither of us as two political parties, know the answer?
Absolutely.
And what's been going through our minds is, are the parties, all of them, despite what they say in public, are they so much better prepared for the eventuality of negotiations next weekend? Are they better prepared than perhaps they were last time round? And therefore, will there be fewer of these consultations as a compromise than we've got this time round? Now, one other starting point for us, I guess, Elizabeth, is that even without a coalition, it's worth going through the respective manifestos to try and guess how many and what nature of consultations we're going to have. Now, we have been doing that exercise, as you can imagine. It's a bit of a soul-destroying task, and it is perfectly clear to us that there are lots and lots of detailed policy proposals which, I have to say, have not been subject to much public engagement so far. I mean, if you saw the detail, and I'll choose one at random. I'm not trying to be beastly to Lib Dems at the moment, but I happen to have in front of me their manifesto, and how many of you, I wonder, knew or know that one of their proposals is to give more black, Asian and minority ethnic people jobs as police officers. Now, I'm not making a comment about whether or not that's a sound policy, an unsound policy, good or bad. All I know, and I'm sure we'd all agree, to actually convert that from a manifesto commitment to a piece either of legislation or of administrative action is actually going to involve rather a lot of stakeholders, as well as political argument, don't you think?
Absolutely.
So where we now end up with is, if you look at some of the proposals, there have been specific commitments to consult, particularly by the Lib Dems.
Yes, they seem to be the most proactive in this area, which is very interesting, but probably not surprising.
Well, have you noticed they have this requirement for a fundamental review of the NHS, being that they've been partly running it for the last 5 years.
That makes me a little curious, yes.
Yes, but they are saying there will be a public consultation and a fundamental review of the NHS, something interestingly that the Labour Party has not quite committed to,
no.
But what they have committed, what Labour has committed to, is replacing the Andrew Lansley Act with something else. Now, what is that something else? We don't know what the something else is, except we know they want to water down the competition elements that have been introduced into the new regime. But can anybody tell me, does the Labour Party intend to keep with CCGs, clinical commissioning groups? Does anybody know whether the Labour Party intends to tinker around with health and well-being boards? They have fine words about increasing the democratic accountability of the NHS. That's a very good thing indeed to suggest. But how would they do it? Is it even remotely possible you could do it without an element of consultation?
Absolutely. So we are, looking at these. We are interested in all of them. I mean, it's not just the main parties, but the smaller parties are also making their promises that will need engagement.
Ironically, the smaller parties are more likely to insist, were they to be involved in any meaningful deal or any meaningful consultation, they're more likely to insist on their pet projects being included in an agreement. Let's imagine, for example, that there is no formal coalition. Let's just suppose that what actually happens is that one party or another, either Mr. Cameron or Mr. Miliband, decides to run an administration, a minority administration, that they will try to avoid, as Mr. Miliband said last night, a deal on confidence and supply. Let's imagine they just decide to soldier forth and cobble together majorities in the House of Commons as the need arises. There might not be the equivalent of the grand coalition agreement that we had last time round. What we might have, however, is an agreement with the 2 or 3 Green MPs or 1 or 2 UKIP MPs, and they would then publicise, no doubt to great effect, that they'd achieved the following concession, the following commitment to their pet project. I suppose UKIP has only got one consultation in mind.
I don't think we need to ask what that is, certainly. But I think, is it time to take a question?
If we have some, I see the questions will be coming in. What have we got?
We do indeed. We have one which says, has TCI any real successes to tell us about from the political classes?
Now that's, Quintin's being mischievous.
Absolutely.
Yes, I think there are, to be fair. One of the most successful innovations, which has consultation sort of written through it, rather like Brighton Rock in the last few years, certainly I regard it as success, is the government's proposals and government's policy on neighbourhood planning. Now, neighbourhood planning in England has resulted in 1,400 separate communities basically engaging with itself. And that was subject to a useful piece of consultation originally. I think they've got a lot of things right. I'm sure there'll be plenty of planners who'll tell me that they've got a lot of things wrong as well. But, you know, credit where credit is due. Let me contrast that with where, following the coalition deal all those years ago, where they probably got it wrong, not in terms of what the policy was, but in terms of the way it was done. I'm sure many of you will remember that the Labour administration, before the last election, had a massive expenditure program called Building Schools for the Future. How many billions is that, Elizabeth?
It was colossal, and it was a program that went back from 2003, and it involved, you know, every school in the country as it was originally envisaged. Huge numbers of civil servants and local authority officials, vast amounts of money, and it was an incredibly complex situation.
And am I not right in thinking, somebody will correct us if we're wrong, didn't the Conservative Party before the last election actually put a manifesto commitment to scrap that programme?
Yes, they did. It was in the last Conservative manifesto.
So come the general election, Michael Gove becomes Secretary of State for Education. He scrapped the programme, and do you remember there was a lot of shenanigans where different lists were published in the House of Commons library as to which schools were being saved and which ones, or the building programmes, the refurbishments, the rebuilding of these things were saved, which were not. Now, the interesting thing about that is, of course, there was no consultation.
There was no consultation, and it could have been a lot better had there been consultation, because then Michael Gove might have had a better understanding of the impact that his scrapping of this programme was going to have.
Instead of that, there was a High Court case, a judicial review, at which, of course, 6 councils, and they weren't sort of left-wing councils, this included Kent County Council, I hope you're listening today, friends in Kent. 6 of the councils that had lost millions and millions went to the court to say there should have been a consultation, and they won. And we use that as one of the leading cases for the doctrine of legitimate expectation. So here we are talking about, will there be more consultations? Any new incoming government, no matter how strong its mandate, or it feels its mandate may be, always has to look to see whether the circumstances of that issue is such that to proceed with a major change without proper public consultation might actually be unlawful.
I agree absolutely, and I think the last 5 years has probably shown us that with more and more cases ending up in courts and more people realising how critical it is to get consultation done properly, we are actually in an even harder place for a government that doesn't do decent consultation.
Now, one has to draw a distinction, I suppose, between those occasions where you go to consultation because there is a need to establish a measure of public support and stakeholder understanding and empathise and rest of it. With those situations where the parties may know in general outline what they want to do, but they are yet to work out the detail. I have with me the two big parties' manifestos. And I'm going to read out to you what Labour, for example, says in the manifesto regarding the terrible issue of child abuse. It's clear, it says, we need a radical change in our approach to dealing with child abuse. We will bring in tough new powers, enabling the police to prevent an adult from contacting or communicating with a child if there is evidence of abuse, which, are sentiments I'm sure lots of us agree with. Again, it's that difference between making a commitment such as that, putting into practice. I am now reading from the Conservative manifesto, and there are similar words saying, as we continue the urgent work of overhauling our police, how our police, social services and other agencies work together to protect vulnerable children, especially from the kind of organised grooming and sexual exploitation coming out of them, we will need to put proposals. Now, nobody can put legislation or even administrative action in place without having extensive consultations. I think if you're working in a local authority, I would sincerely hope that one of the things you would see in the wake of a new administration is a proper, sincere, professionally conducted exercise on the part of government to seek your views and to draw upon your expertise in pursuing issues of this kind.
We've got another question which I think is worth thinking about, and of course we must consider England, Ireland, Northern Ireland, Scotland and Wales, and there is a question about how does consultation practice vary across the UK jurisdictions?
That's a good one, isn't it? Because of course the code of practice from Whitehall doesn't really apply, at least not properly applies. I mean, I think they may borrow bits of it in Wales, Scotland and Northern Ireland. I know that Quentin Oliver, our chairman, has been undertaking a fascinating exercise recently of talking to each and every individual department in the Northern Ireland office and asking them very openly, and I'm grateful to departments for responding in the main very constructively, asking, how do you do the consultation? What was your project plan? And what we've been trying to do is build a picture in our minds as to whether the practices vary to any great extent. I'm not sure that we've yet found much of this. I suppose there's one conclusion, Elizabeth, certainly Whitehall is relying more on online consultations than maybe the other countries.
That could be a matter of scale and size of the different countries, but we do know that it is not the very best practice, useful as having online consultations are, if they aren't backed up with the plethora of other methods that can and should be used to ensure that everybody is properly engaged.
And of course we've just had a new High Court judgment, the first one I can remember on this, that actually says how risky it is to over-depend upon websites and online consultation. If anybody's interested, it's the case of, let me remember, Kendall against Watchford District Council. It's something that happened in the wake of the Dale Farm Gypsy and Travellers site being disbanded. And that case, the Watchford case, I think is going to be very, very important because it basically says, as a planning authority, you were unwise to rely too much on online questionnaires. I see questions coming in thick and fast, Elizabeth. What do we want to tackle next?
Well, this is Chris Witherington. Hello, Chris. Talking about the integration of health and social care, which seems to be the holy grail for reducing costs, and yet there are huge changes going through that haven't involved any public consultation, like the new vanguards and things. And are these deals likely to continue to be done behind closed doors?
Yes, the vanguards are the 25 projects in NHS and social care. I got into a bit of trouble recently when and I was doing it, best of all reasons, when I just posed the question on LinkedIn. If those of you go to our LinkedIn site, I think I posed the question how much consultation there'd been, and I had a very indignant reply from somebody in the NHS, pointing out there'd been an enormous amount of local dialogue, so I'm sure it varies from time to time. The Better Care Fund, in my judgment, has struggled in terms of its acceptability in localities, in terms of its getting off the ground properly. I was talking to our friend Crystal Burler in Warwickshire recently about this, and I think part of the struggle has been that it hasn't been underpinned by sufficient public engagement. I'm not sure whether you need consultation. You may need to consult if you are radically changing services as a result of the integrated fund money that is the Better Care Fund, but I certainly think the engagement needs to be a bit more. It's interesting, if you actually look at the two major parties' manifestos, they all pledge more money to integrating health and social care. There's not a lot about how the responsibilities are going to be carved up between local councils and the NHS. I think there's a lot of work in progress there. I am absolutely sure there will be a lot of consultation.
So as we sort of move towards the conclusion of this chance to think about these very important and critical matters, I mean, Rian, you know, it's all very well talking about being drowned by consultation, and that's the last thing we as the Institute want. But I mean, we feel that it's the quality that matters much more. So how do we get that? Whatever happens, whoever's in charge, whatever's going to go on, how can we achieve decent quality consultation?
If you go back to that Tuesday topic I wrote 5 years ago, and I said, you know, there'll be civil servants sharpening their pencils for this, I do have a worry that too many civil servants sharpening too many pencils at the same time, we could end up with rather a lot of consultations, and they might not be very good. Our challenge, I suppose, in the Institute is to convince ministers, to convince senior civil servants, council chief executives, chairmen of CCGs, to convince senior people that unless the consultation is done to a particular standard, actually they won't get from it that which would help them do a better job and take better decisions. Do I see some last minute questions you want to?
Yes. So here's one. Does TCI feel there will be further major changes to commissioning health services after the election once again? Where does good practice consultation fit with this?
Part of me hopes to goodness that they won't tinker around too much with commissioning. There's nothing wrong with the commissioning model in one sense, because the commissioning model, when commissioning is done properly, does a lot of stakeholder engagement and consultation. It builds it into the commissioning cycle. What I think none of us want is commissioning done in such a way that ignores the wishes and the views and the priorities and the preferences of patients and other key stakeholders. So I hope they won't change too much. My fear is that there will be another political realignment of some of the components of the NHS. The Lansley changes, let's be blunt about this, were not in any manifesto 5 years ago. There was a consultation. It wasn't a very good consultation, and I sometimes wonder whether David Cameron hasn't regretted for the last few years that he didn't actually intervene more radically than he did. If you remember, he put a pause in for the NHS. The NHS needs a period of considerable stability. Now, the other thing that we ought, of course, to put on record is there are a lot of public consultations that are going to happen anyway this autumn, regardless of who wins and who loses this election. Elizabeth, you and I know of at least a dozen in the NHS, and I cannot see any change of government that would stop those consultations taking place. I've got a feeling that some of the proposed reconfigurations that are on the table might have less of a chance of being implemented. I think the consultations will go ahead. There are councils waiting to close libraries, dare I say it. There are fire services, we know, which need to rationalise their fire stations. There are police forces. So there's a lot of these things that have been put on the back burner because of PERDA and elsewhere, and because these will happen. It's not what we're talking about, you know, as coalition-driven ones, but I think they're going to happen in the next few months.
We just talked about health, obviously an absolutely key and critical subject, but I mean we know how much planning, and particularly neighbourhood planning, is going to be still on the books. And someone has asked, do you think local involvement via neighbourhood planning will be further encouraged by successive governments?
Yes, I think it will, actually. And that's got nothing to do with politics. I think it's to do with the changes that we're seeing taking place, social media, changes in people's expectations of the degree of involvement that they've got. I think, I mean, just imagine, right? Do you realise the Lib Dems have got in their manifesto that we're going to have 10 new garden cities, right? I mean, when Labour proposed this about 12 years ago, it got into a terrible tangle as everybody in the south of England rushed to ensure that it wasn't them. So planning on a kind of regional basis, let's put a new garden city somewhere in this leafy bits of Surrey, right? That is a million miles away from the bottom-up neighbourhood planning that has encouraged the kind of involvement we've had. So my answer to that actually is, and by the way, fracking and other similar issues that distress communities. Communities now know how to react, and they are better able to organize themselves and their websites and their social media, and therefore there's an inexorable inevitability about more involvement at local level. Policymaking at governmental level is a different game, and it's a different set of parameters.
You've just given me a lovely segue into what I fear is probably going to be about our last question. But someone has asked us, do you think any party would aim to go further than the current policies in terms of community involvement?
Well, of course, we have a manifesto we put out. We didn't call it manifesto this time. No. A better engagement agenda, because we have lots of ideas as to where we should go. I think the parties probably want to make haste slowly. I think they realize that you are unleashing the dragon of public opinion in a very, very unpredictable way. And although they talk the language of very rapid radical change in terms of public empowerment and public involvement, reading these manifestos, I think they are rather hoping it doesn't happen too enthusiastically.
And this actually is nicely chiming in with another question, which says there seems to be a shift from consultation to more public engagement. And from what I hear, change appears to be around NHS social care agenda. Would we agree?
Well, I think people will try it. The trouble is, people don't really want to be engaged when there's a major change. They actually want to be consulted. Because the point about engagement is there are no rules. There are no standards. You know, I can say I've engaged you because I've had a chat with you. What people want, in my view, is the opportunity to place their considered views, what the gunning principles, to be legal now, the gunning principle called an intelligent response. People want to give an intelligent response to a well-informed, well-articulated set of proposals. And they want to know and have the certainty that the law will give them that those views that they express will be properly and conscientiously considered. So I think there'll be lots of bodies, NHS including, who'd love to say, well, tell you what, we'll engage with you. We won't consult with you, we'll just engage with you. I don't think that will last more than 5 minutes in any serious dispute. I think people want to be consulted, and I guess we're here to make sure that when they are consulted, they've done so to a reasonably satisfactory standard.
Well, I think we have all got another week of sort of tension, seeing what's going to happen, seeing what other promises, other things are said. But of course, it isn't going to be until next Friday, Saturday, the weekend, the week after, that we're going to know how this is all going to play out, if the dust will settle and what state we'll be in. But I think both of us would say consultation's not going to go away, and that whoever is doing it, there will be, and hopefully it will be done well and considered consultation for us all.
So we'll go away now, but maybe we'll come back in a couple of weeks' time and we'll reopen this subject to see, in the light of the results of the election and in the light of whether or not we have another coalition agreement, whether we can divine any further thoughts on this. We should thank everybody who's sent in the questions.
Yes, great
You all came in at the end. There we are.
But thank you all so very much.
Thank you, Elizabeth and Rion. Today's webinar is now ending. You will all receive an email asking for your feedback, so if you could send that to us, it would be very much appreciated. We do hope that you've enjoyed today's webinar, and we look forward to joining you again very soon. Thank you.